I'm going to start with the pectoral girdle, which is comprised of the clavicle, the scapula, humerus, ulna, and the radius. And of course, the carpals, metacarpals, and phalanges, the entire arm. The scapula are attached to the thorax and the vertebral column by muscles on the surface. The pelvic girdle is attached to the skeleton by ligaments, the axial skeleton. And it's comprised of the coxal, it's out of the way here, your femur, the tibia, the fibula, the tarsals. I need to get down. Kathleen Ayers and my appendicular skeleton video. I'm going to start with the clavicle, sternal end, right here, sternal end, acromial end. You see that right there? Scapula, coracoid process, my goodness, right here. The subscapular fossa here. The glenoid cavity here. Right here. The acromion. Right here. The supraspinatus fossa. Right here. Can you see that? There. Hold him with both hands. Oh, there we go. Right here. And the infraspinatus fossa here. The sternoclavicular joint right here. And the acromioclavicular joint right, bend him over here. I'm going to point out parts of the arm, the humerus. I'm going to use this arm here. This is the humerus. This is the head of humerus. The great tubercle, the greater tubercle is right here. The lesser tubercle right here. Deltoid tuberosity here. Medial epicondyle right here. The coronoid fossa in here. And what goes in here is the process of the ulna, the capitulum, which articulates with the radius. And that is right here. The trochlea, which articulates with the ulna. That is right here. The lateral epicondyle, which is right here. I want to make sure I got the right side, right there. And the ulcranian fossa, which is right here, and the process of the ulna goes here. The ulna, this bone here, olecranon Olecranon is here. So you can see that. And the coronoid process is here. The ulnar styloid is here. On the radius, just this bone here. The radius head is right here. The radius tuberosity is right here. Radial styloid process here. Okay, the proximal row, the scaphoid here. Lunate here. Triquetrum here. This trapezium here. The trapezoid here. The capitate here. And the hemate here. The metacarpals are these bones along here, including this one here. The phalanges are these bones here. The bone for the wrist that joints with the forearm, the two bones are the lunate and the scaphoid, here and here. And the bone that forms the joint with the pollex is the trapezium here. Girdle, the three bones that make up the pelvic girdle. The ischium, and that goes down under the pubis. And the ilium, which is this big back part. And those three bones fit together to form the pelvic girdle. The pubic symphysis is here. Acetabulum is here. See that? Yes, I think. Yes, you can see that, okay. The obturator foramen is this hole. And there you can see it there on this side. The iliac crest here. The anterior superior iliac spine here. The iliac fossa here. The greater sciatic notch here. Ischial spine here. And the ischial tuberosity here. I'm going to cover the femur now. So the head of the femur, the greater trochanter here, the lesser trochanter here, the adductor tubercle here. Let's see if you can see that. Here. The medial epicondyle here. The lateral epicondyle here. The medial and lateral condyles, there they are right there, here and here. And here's the medial lateral condyles. And the patella, right there. The tibia, medial and lateral condyles of the tibia. Lateral condyles are here at the top. The medial malleus is here. The proximal and distal tibiofibular joints. Distal, proximal. My hand in the way. Distal and proximal. The fibula here. The head of the fibula here. And the lateral malleus here. Okay, I'm going to do the tarsus now. I'll start with the talus. Let me use this foot here. The talus, the calcaneus, the cuboid here, the navicular here, the medial, intermediate, and lateral cuneiform bones. The medial is here, the intermediate is here, the lateral is here, the metatarsus are these long bones here, and the phalanges are here, 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 and this is the hallux.